Howard Rosen comes to us from really a production background, and if you were to look at his vitae, you'll see one of these things is not like the others, and that would be Howard, I think, on this whole program, given that he's been involved in, $100 million worth of production and development and that kind of thing in the entertainment and especially in the film industries, and so I think brings that unique perspective as he chose to turn his sights to, what can we do in a really low-end, low-technology kind of way to use smartphones and things, agnostic as to platform, and really with very simple, messaging to improve, among other things, the scheduling problem that the congressman and others have just been talking about, I should think. So, Howard, why don't you come on up and share some words with us from all the way from Canada, Howard Rosen. Thank you.
Thanks, Neil. I appreciate that. And for the introduction, and while we're setting up, it's nothing like having to follow Dr. Darkins, Dr. Waugh, and Congressman Benishek to round out the day. As Neil said, my background very quickly is a traditional healthcare background, having produced film and television for 25 years before getting into healthcare. But what it brings for me is the background of communication. And that's where really fundamentally I came to this from that perspective. And what, in terms of LifeWIRE, what I'm doing is to talk about some of the insights and the lessons learned is 8 years of development, going through alpha versions, beta versions, pilots, studies, very, very determined audits, rollouts with clients and rollouts with clients. And in fact, over the 8 years, the platform we're operating now is built with over 2,000 insights from the various groups that we've spoken to and we worked with over the years. And the key thing about it is, so what we have today is LifeWIRE, as Neil suggested, is a cloud-based communication platform that's highly interactive, that is responsive to the patient's needs, responsive to their inquiries, responsive to how they interact with their provider, and at the same time it's responsive to have an outreach depending on how they actually respond to their messages. So against all the rules of entertainment, I'm going to give the punchline first. So all the lessons learned and all 2,000 insights come down to communication is a dialogue. It's not just sending a unitary message. And in terms of being successful with the groups that we're working with, yes, it's managing a patient on a one-to-one basis, but more fundamental, it's population management and managing 10,000 patients as easily as you have one patient. And in all those parts, and again, what LifeWIRE is built around is being able to do these kind of messages for the one or the 10,000, where the messages themselves have to be relevant and they have to be personalized. So it's got to be tied to a person's needs at that moment in time and to the needs of the case management team, the care management team, the information that they need at that time as well. You've got to be, a key thing we learned is a non-response is as important as a response. So it's fine to send a message, but you have to have a way to measure those non-responses, because if they don't respond, there may be reasons why they don't respond. So it may not be as important to you if they don't respond once or twice, but maybe 3 times. And so you need a system and a means of outreach to know when they've not responded to you as much as when they have responded to you. Similarly, as we obviously talked about, it's interactive. So it's got to be dealing with a situation where it's not just pushing a message, it's what is the response, how are they responding, and being able to have a response to those responses on an automated basis, very simple, but giving the people feedback, and the members, and particularly with the work we do with the veterans, feedback to what they're saying, so they know that it's just not going out there in cyberspace, that there is actually true tie-in to what they're doing. Must involve the ecosystem. The solution is not a solution, frankly, if it's just helping specifically only the patient's needs. It has to help the provider, it has to help the clinician, the case manager, all up the entire healthcare chain to help them, including the peer support of the individual themselves. So it's not just on the health side, it's also on the social outreach for that individual. And it's all these pieces that come together that create that ecosystem that you need to tie into based on the success we do. And of course, engagement, though it's listed last, it actually should be at absolutely every line. You hear it all the time about the need for engagement. Fundamentally, absolutely it's got to be engaging, but how do you engage? It's by hitting on all these various pieces. So we talk about a communication. Well, what kind of communication? There's lots of communication out there. There's mail, there's voicemail, there's phone, there's SMS, there's email, there's web portals and more. The key thing is that should I be the one to tell the patients, the providers, what kind of communication, or is it more important that they tell me what kind of communication? How you can get the greatest insights and the greatest response from them. And the two main ones that people use, of course, one is apps. Lots of apps, hundreds and thousands. Like last check, I saw it's 890,000 apps available. So you can go crazy with apps, no problem at all. However, the big issues we found with apps, we explored in early days using apps. Part of the problem was an app is siloed to a phone or a tablet or to an operating system. You have the Apple 5S, you have Apple 5, the Apple 4, you have Android 4.2, 2.3. You have to have different apps tied to different things, and as a business, on both sides of it, it gets very expensive to try to cater to the particular needs. And then down below, then you have to have updates all the time. So you're spending more time on the tech side and the IT and creating apps and the individuals than you are actually managing the patient. And tying into that is most of the apps that are out there are proactive. They require the patient to, oh, okay, it's 2 o'clock, I'm going to have to send a message, put some input, do this open diary, do something. That's nice. The problem is on the behavioral side, we've learned human nature is no one likes to be proactive for the most part. It's reactive. It's better to ask them something as opposed to having them tell you something. So your systems need to tie into that in your communication. And fundamentally in terms of, again, apps versus non-apps or other approaches, the biggest issue we found into in many apps is no real-time connectivity. You put the information in an app and it sits there in many cases. Our experience has been working with vets and active duty and even the civilian world is they really want real-time feedback. They're going to, you ask them a question, you're sending a message, they really want to have a feedback right away in one form or another. Or you get a drop-off in terms of the usability. So we went to, instead of telling everybody, this is what you should do, this is how you should communicate, we said, you tell us how you want to communicate. The platform itself, we can do all the communication yourself. We can do IVR, we can do email, we can do phone, but everybody wants text message. Doesn't matter what the socioeconomic demographics. We've got 12-year-olds on the system. We've got 73-year-old senior citizens. We've got homeless vets in Hawaii. Every single one of them, they want to use text messaging. In fact, it's down to less than 1% on our system are using email. No one's touching IVR in terms of doing it. And when you're looking at 6.5 billion messages sent every day in the United States right now, it's a rather pervasive means of communication. So we said, instead of fighting it, let's work with it and work with what they want in terms of, to go back to, again, that E word, the engagement. Let's work on how we can engage them to do that. As a result of that, of course, is when you're doing something like a text messaging, and that every phone in that case, since 1999 has been built with text messaging built into it, right now we could light up any phone of the 7 billion phones in the world right now in 30 seconds or less. So we don't care where you are, what system you're on, who your mobile company is, we could light you up and get up and running. No upload, no download, you're up and running right away. So again, on the behavior management side, in terms of barrier to utilization, we've taken out that barrier because of making things as instant as possible. And one update is worldwide. So we just update our major servers, everything is updated. No stars, no notifice on your phone, no waiting to be in a Wi-Fi zone to download updates, it's automatically tied into it. But what about tomorrow in terms of communication? That's, yes, text messaging today. In 5 years' time, it's not going to be text messaging, but I can tell you most likely it hasn't been invented yet, but in 5 years it'll be completely different. If you look where text messaging was 5 years ago, we had email predominant, and then before there, the numbers, and from the numbers Dr. Waugh showed in terms of the change of technology and the rapidity of technology, it's very possible, we haven't even seen what that new technology is, but it's not going to be text. But the key thing that we found is to follow what people actually want to use as opposed to telling them what to use. So I said the vast majority of our clients are using and requesting SMS whenever, and I said the clients in terms of our customers and their clients being the patients, the vets, very particularly the vets want text messaging. But ultimately, it really isn't about the technology. And as you hear from the presentations earlier, and they sort of took a little bit of the wind out of the sails, it's not the technology. It's really, at the end of the day, what you want to do is provide the vets or the active duty members what they want, how they want, when they want, and with whom they want. You cover those pieces, that provides you again, that level of engagement, that level of data that you need for that communication, having them communicate with you. You need all those pieces. So you need a system or a platform that can provide that easily, as easily as typing on the screen. So from a solutions perspective, again, this was all built, again, I was not originally propeller head. I think people argue maybe a little bit one of now, but I didn't start off that way. I really started off as a communicator and engager. My job was to put bums in seats. If I didn't put bums in seats, I no longer had a job. Now my job is I'm working to engage clients. But, so it's from a user need perspective, so I didn't push the technology, but it's also not just the vet. It's also about the care management team and the support team, because if you're not, the case managers and the care managers aren't using it, it doesn't matter if the vet wants to use it. It has to be something that really ties into everybody's needs. So you need a solution that improves the effectiveness of the case manager and the providers at a price point that works for them, and again, has the ability of dealing with population management. It's not 3 or 4 or 10 vets, it's 10,000 at a time, and still have these value propositions of being personal and relevant on an individual basis. So that's, that's great. I got these great ideas. I've been doing this for a long time, and had a cool career before, really cool now actually. But at the end of the day, what's really valuable are results. Are we getting results? It's fine. We've done all this and spent 8 years and kids on craft dinner quite a lot. But it's all about results. So the first, really, for me, the magic moment for me came, which is about 2.5, 3 years ago, that this quote relates to. That was actually provided by Mr. Link Smith, who's the CEO of the Altarium Institute, which was our first study that we did involving a pathway home, which is an NGO in California working with vets, a residential program, vets with PTSD. And we had just started the study. I think we're only a month into the study when I got a call midnight one night from Fred Guzman, who's the executive director, and basically he said, just pick up the phone, Howard, just to call and let you know you saved a life today, and hung up. And within, I would say, Bill was there, I think it was within 3 weeks, we went from that phone call to being on the Hill, and Link Smith speaking to the subcommittee on health and veteran affairs, talking about the relationship was basically an outreach for LifeWIRE. Very quickly it was, this individual was in a residential program in California, went home to Kansas City. And he got regular messages, just checking in, just a check-in, not alerts of how you doing. One night he got into a horrible, physically violent, physically ill, couldn't communicate. Wife called the VA, get him in the EMS. He's in the ambulance going over there. As they're rushing over to the VA hospital, all of a sudden, a little message comes in, how you doing today? And has an escalation element into it. So the wife knew, hit 5. What 5 meant was message went right off to the case manager in Yountville, California, and to his buddy in Kansas City. And Kansas City buddy calls in, what's going on? He said, well, John is having his fit. Wife gave the phone to the buddy, so he's at least listening to him, so he's sort of helping to calm him down. Same time, the case manager calls in on the other phone, to wife's phone, so what's going on, and gave it to the EMS manager, EMS attendant, explained what was going on. The guy from Yountville said, look, I know this dude. He had an IED problem. He suffered huge migraines. Yes, he's had psychotic, but huge migraines. What you're describing is his migraine. I can't diagnose over state lines. You all know that, but I'm just telling you, if there's any way you can nudge him to emergency as opposed to the psych for observation, I think you'll find that is the problem. To make a very long story and long evening short on it all, 5 hours later, he was home with his family. Dr. Guzman said, had he gone to the VA, he never would have left. So at that moment, kind of get, oh boy, I guess I have to do this a bit more. And that really launched us to really accelerate LifeWIRE. So that's a great anecdote in terms of results. Just very quickly, in certain 3 recent results we did, dealing with readmission issues, a control group, we're dealing with mental health. Of that control group, 10.75% of the individuals had to have readmitted. The LifeWIRE group, not one individual was readmitted. Dealing with presenting for 7-day follow-up and the no-shows, the client who does not want to be named, but on the military side of things, they had a 30% no-show rate. Those when they're using LifeWIRE was 7% no-shows. And in terms of substance abuse relapse, the control group was 30% relapse, the LifeWIRE group was 13%. So we're getting results, obviously we're getting a lot of attention, and we're getting excited because with all the insights we get from this, we actually reinforce and refine the system as it goes. A final thing, this actually just came in a couple of days ago at one of the VAs that we're doing work with. They said there's an individual who basically in this high-risk suicidal area who disappeared, lost contact with him for 5 days. Huge panic, couldn't hear from him, didn't know what was going on. All of a sudden, 5 days later, he comes back. He's fine. He said, well, what happened? He said, well, even at my darkest moments, I was still getting the messages from LifeWIRE. In his case was a lot of motivational messages. And he got those messages from LifeWIRE, and it just kept me going until I got the message here, which was, if it's too much, stay in touch. Remember, we're here for you. Call da-da-da-da-da, which is the phone number for the case manager. And there was a link. Put on the link, got in touch with the case manager, and he was fine. Again, it's a great story as an example of the types of things. We have that on a day-to-day basis, not as extreme, obviously, but in terms of a means of how the communication is working with the individuals and the value it's having to them. At the end of the day, the value and the success that we're finding ultimately is providing the power to manage the dialogue with the vets. So in many cases with the clients, they'll start off with, we work with them in terms of here's a set series of dialogue, which is here's questions, here's interactions, here's motivations. That on a general work with population, and they're all put before a focus group of peers. So it's actually tested before it even goes live. So everything is focus group. There's nothing that goes out without a focus group with our various clients. Then it gets up in the field, then it gets up and running. And what the case managers have done time and time again, they ask the individuals, well, what message is valuable to you? And they say, oh, okay, this and that, and they add that to the list. And so when it goes to the next vets, he said, well, here's the various pockets of messages. And that builds over time. So again, it's more and more relevant. So now, in one particular client that's been on for 18 months, the set of protocols they're using are completely different from the initial set of protocols that they started with, because they found what becomes relevant. There's a particular element about that which was really quite amazing. When I was at the VA, we had a gentleman came over, very dour looking, very strapping, but very dour looking. And his name was Steve, and the case manager was talking, and they sort of back and forth, and he said, by the way, Steve, the message you gave us last week that you're using, we put it in our list of protocols so we didn't identify you, and every single person, every vet since then has been choosing your message as one of the messages they want. And just for a second, he sort of looked, he stood up straight, a bit of a smile on his face, and he said, I'm still helping my boys. And he just sort of walked straight down the hall. It was really a magic moment. I know I got to tie up. That's all well and good, but again, fundamentally, you heard it before, we have those outreach, we have these abilities. With the case managers, it's also got to tie into existing workflows. This is not about creating new workflows, it's tying into existing workflows and redeploying their resources. It's taking the most expensive resource, which is human capital, which seems to be where everyone starts at the top of the chain. This is the first thing they're going to do. They're going to have admin staff do the call out and the interaction. What we allow them to do is to replace that with an automated system and redeploy the resources and deal with that 20% of the group that traditionally are problematic and get a better sense of discerning who they are. At the end of the day, very quickly, the other piece of it all is having an executive officer friendly approach and having an ROI. It's results and ROI, something they can roll out with. And by automating the dialogue and non-responses, again, we're redeploying the most expensive resources to where they're needed. The final piece is just usability. You saw this circle, actually Dr. Wide used this. We're dealing with privacy, security, and usability. Usually they don't even touch each other. What we've been working on is finding a way to tie them together so we can actually deal with the world of usability and security and the privacy. As a result, we're HIPAA compliant. We've got ePro validation, which is an audit standard with the FDA in terms of the value of the database itself, the security and privacy. We're Department of Defense in terms of encryption standards, to the point you brought to the security. Encryption standards are set to present day of the DODs to deal with cybersecurity and cyber issues at the same time. And in the end of the day, it's all about dialogue and empowering the vet and the active duty personnel. And it's still, regardless of the technology and the approach and the communication, it's giving them what they want, how they want, when they want, and with whom they want. And thank you very much.